2019માં એક વોટ્સએપનું નાનું ગ્રુપ ચાલુ કરેલું. એનું નામ અનાયાસે ઓટલો એટલા માટે આપ્યું કે જેમાં કોઈને પણ આવવાના આમંત્રણની જરૂર ન હોય. કોઈના
આપનો આવકાર છે. નમસ્તે ભાંજીભાઈ.
Thank you, Geetaben. Thank you, Suvasbhai. Thank you, Jagdishbhai, for inviting me. Thank you, B. Patel. So it was really honor for me. અને ઘણા બધા જાણીતા ફેસ એક સાથે જોવા મળે છે. બહુ આનંદ થાય છે. જીતેનભાઈ, ઘણા બધાને, અરવિંદભાઈ, બધાને એક યા બીજી રીતે મળેલા છીએ. તો ખાસ કરીને મને ઓટલાની કન્સેપ્ટ બહુ જ ગમી. હું બધાને કહેતો હોઉં છું કે ભાઈ એને જોબ ત્યાં કેમ, કોઈ રોટલો ત્યાં ઓટલો. એ રીતે આપણે typically I was just as a કાઠિયાવાડી, this word I using very often. જ્યારે આ વાત થઈ છે ત્યારે બીજા વર્ડની વાત કરું કે મારા ફાધર ને મધર મારી સાથે રહે છે, રહેતા. ફાધર હમણાં ઓફ થઈ ગયા છે. તો એક ફિઝિકલ થેરાપિસ્ટ મારી સર્જરી પછી આવતો અને એને કે તમારા હું અહીં આવું અને તમારા પેરેન્ટ્સ ન સાંભળી શકે એ મને ના ગમે. તો હું કોઈ એને તું પૂછ કે તમે કેમ છો. તો એ આવી અને બાપુજીને બાને કે કેમ છો, અને બાપુજી એકદમ એટલા બધા હરખાઈમાં કે વાહ વાહ વાહ, અમને કોઈ પૂછ્યું નહીં તો બોલવા જ માંડે બહુ મજા છે, બહુ સારું છે. તો એક દરરોજ આવી અને એને ઇટ વોઝ અ રૂટીન કે કેમ છો. તો એક દિવસ મારો ફ્રેન્ડ આવ્યો, એ મારી સાથે જ છે, મારા બેસ્ટ મેન હતો મેરેજમાં. સો મીન્સ વી આર ટુગેધર ફોર ધીસ મેની યર્સ, લાઈક 44 years. તો એને પેલા પૂછ્યું કે કેમ છો. તો મારા ફ્રેન્ડે કહ્યું કે હાકલા. ના યુ નોટ સપોઝ ટુ સે કે મજામાં છું એમ કહેવાનું હોય. તો કે હાકલા ઇઝ ઓર મજા એમ. તો ધીસ ઇઝ લાઈક સો સમટાઈમ્સ વી યુઝ અવર વર્ડ લાઈક તમે જે રીતે ઓટલાને જે રીતે સારા વર્ડને કઈ રીતે આને એક સારા કામમાં લીધી જઈને આનંદ થાય છે. તો હવે હું વાત કરવાનું છું કે 3 વસ્તુને મેં કહ્યું છે કે આઈ ડોન્ટ નો કે હું આજે કરી શકીશ કે નહીં મારા કમિટમેન્ટને હિસાબે. પણ લેટ મી સ્ટાર્ટ વિથ COVID-19. આપણને બધાને ખબર છે, એટલું બધું ટીવીમાં આવે છે. મને એમ છે કે આપણે દરેક વ્યક્તિ પાસે PhD જેટલું નોલેજ છે. પીપલ કેન સ્પીક ફોર અવર્સ. એટલે આટલા બધા સ્માર્ટ ઓડિયન્સમાં કંઈ નવું લઈ આવવું કે ભાઈ આમાં શું છે, તો ઇટ્સ લિટલ બિટ ડિફિકલ્ટ. હાવેવર ઘણું બધું ચેન્જ થયું છે. લાઈક જ્યારે આપણને ફેબ્રુઆરીમાં ખબર પડી, આપણે કેસ જોવા મળ્યા કે આનું શું કરવું, ત્યારે એમ હતું કે ભાઈ આ વાયરસ ન્યુમોનિયા છે. આપણને બધાને ખબર છે કે આપણા દેશ યુએસએમાં દર વર્ષે 80,000 પીપલ વાયરસ ન્યુમોનિયાથી મૃત્યુ પામે છે. પીપલ ડાઈંગ ઓફ વાયરલ ન્યુમોનિયા ઇઝ વન ઓફ ધ મોસ્ટ કોમન કોઝ ઓફ ડેથ. તો જ્યારે આ કોરોના વિશે આવ્યું ત્યારે બધાને એમ છે કે આ એક ગાર્ડન વેરાયટી ન્યુમોનિયા છે. અને they thought કે ઇટ્સ અ વિરુલન્ટ, કે બહુ વધારે છે એનું ઝેર કે જે શરીર ઉપર જે છે. પરંતુ that will be like might need a little bit better thing. બીજું કે અત્યારે એટલા બધા વાયરસ વિશે આપણે જાણીએ છીએ કે એને માટે કોઈ ટ્રીટમેન્ટ જ નથી. એટલે એને પ્રાઇમરી ટ્રીટમેન્ટનો તો સવાલ નહોતો. જે કંઈ કરવાનું હતું એને સપોર્ટ કરવાનું હતું, સપોર્ટિવ કેર. તો આ સપોર્ટિવ કેર કઈ રીતે કરી શકાય અને એને માટે શું થાય. તો ત્યારે સપોર્ટિવ કેરમાં જ્યાં સુધી પર્સન કેન બ્રીથ એને સપોર્ટ કરવાનો, ઓક્સિજન આપવા. ઇફ હી કેન નોટ બ્રીથ, ગીવ ધી રેસ્પિરેટર એન્ડ આફ્ટર દેટ યુ જસ્ટ લીવ ઇટ અપ ટુ વોટ એવર યુ કેન ડુ. તો આવી રીતે જોઈએ તો વી હેડ ઓલમોસ્ટ 20% people who survived after they going on the machine. That we all know. આપણને બધાને ખબર છે. તો આજે આપણે જુલાઈમાં what we know કે we are not only dealing with viral pneumonia, but this pneumonia, this virulent virus is playing lots of new tricks which we didn't know. સામાન્ય રીતે વાયરસ ઇન્ફેક્શન થાય તો એમાંથી એ લંગ્સમાં વધારે ઇન્ફેક્શન થાય અને આખું લંગ્સને ઇન્ફેક્ટ કરી અને એક્યુટ રેસ્પિરેટરી ડિસ્ટ્રેસ સિન્ડ્રોમ, તમે ઘણી વખત ARDS નામ સાંભળો છો કે એક્યુટ રેસ્પિરેટરી ડિસ્ટ્રેસ સિન્ડ્રોમ કરે પછી બીજી કોઈ ચોઈસ નથી હોતી રેસ્પિરેટર સિવાય. પણ આ વાયરસમાં જોયું તો પીપલ વેર નોટ ડાઈંગ ફ્રોમ ARDS. There was something else. There was some small blood clot. And the blood clots were going in the small artery and veins as well as everywhere. So most of the blood clot which came initially, that the young people were coming with the stroke, which was very unheard of the other virus infection. People had I saw a case like 2 weeks ago that 79 years old black female came with a severe shortness of breath. Since we were aware of this blood clot, we tried to study that what's the situation. Then we found out she had a very large clot in the spleen, kidney, 2 large clots in the lungs, and the stroke. So immediately we put this patient on the blood thinner therapeutic dose, and in 48 hours she was completely normalized. So this information we were missing before. So let's try to see what they're doing it. Usually when the virus infect, you might be hearing about the ACE2 receptor. These are the special receptor which is present in the kidney, is present on the lungs, present in the brain, and your GI tract. Means gastrointestinal, stomach and intestine. So this is the route the virus can enter in the cell. Virus have a very small genome. Like if you talk about the human genome, it's about 3.2 billion base pair. એક microscopic cell માં એક મીટર જેટલું લાંબુ DNA હોય. Can you believe that? How it can be? Like it was less than a salt નું જે કણી હોય ને, એનાથી નાનું સેલ હોય, એ સેલની અંદર 1 મીટર જેટલું લાંબુ DNA હોય. અને DNA તમારે જે કાંઈ પણ genetic information છે એ pass on to for your living as well as for your next generation. જ્યારે વાયરસનું જીનોમ બહુ નાનું હોય છે અને એ જીનોમ પાસે એને ડિવાઈડ કરવાની કેપેસિટી નથી. લાઈક આપણા હ્યુમન જીનોમ્સ પાસે તમારી પાસે જીન હોય તો એવું જીન તમે બનાવી પણ શકો. આપણે જોઈએ છીએ કે ક્લોન બને છે. યુ ટોક અબાઉટ ધ ઇંગ્લેન્ડમાં જે વોટ્સ ધ નેમ ડોલી બને ક્લોન. સો આ રીતે ક્લોન બને. જ્યારે વાયરસની પાસે પોતાની મશીનરી જ નથી. સો વન્સ દે ઇન્ફેક્ટ ધ સેલ, તે હોસ્ટની એ સેલની મશીનરી યુઝ કરવા માંડે અને એ ડિવિઝનમાં કે કોઈ પણ એના બીજા ફંક્શનમાં યુઝ કરે છે. Typically when virus infect થાય ત્યારે cell start producing several products. And an important નામ તમે સાંભળ્યું, interferon. Interferon is a very popular drug for hepatitis C. It has been used for so many other which I not go in a detail. But interferon means it interferes with the virus replication. But any સાથે there are lots of other chemicals are produced by this virus. And most of the time you need some cytokines so you can fight with the virus. But coronavirus or COVID-19 is the name of the disease that produce large number of viruses. And that virus, it's called cytokine storm. Cytokine means there are small chemicals. It's not like a hormone, but much smaller. They work like in nearby vicinity. So cytokine storm, they can produce interferon. Usually there are 17 times different interferon. But this interferon gamma, which is very, very important for protecting and fighting. And the other thing is interleukins. The inter means leukins means white count. So they support the other white count and they communicate with this. And there are 35 various interleukins. So particularly interleukin 6, interleukin 1, and interleukin 10 are one of those important interleukins which are produced, and they causing the cytokine storm, and these cytokine storms causing the ARDS, severe infection, blood clot, and death. There are some macrophage. These are the cells specifically produce what is called tumor necrosis alpha. I'm sorry, I'm just going lots of chemical words which you don't need to remember. In short, there are lots of chemicals are produced that chemicals in the beginning is necessary to protect. However, when they produce too many, they kills the person. So today, compared to February, today we know that the people not dying from the just pneumonia, but dying from the blood clot. So there is a very aggressive, as I told you in my patient right now, patient comes in the hospital, immediately we put him on the blood thinner. Usually the blood thinner is given in prophylactic dose, but because we found out that the corona causing a severe form of blood clot, so we give a little bit higher dose and more, instead of once a day, we use twice a day. And as soon as we find out the patient has harboring any clot, we go in a full-fledged blood thinner. It's called the therapeutic dose. Second thing, we have learned there are lots of other chemicals, like Israel people has found out that the alpha defensin, this particular chemicals is causing like a severe kind of a storm in the body, and it's very hard to control. And so they have a like old drug colchicine people using for the gout, and that drugs can be used. Third thing, the oxygen level. Usually, most of the time, people starts getting symptomatic when their oxygen go down. While in this disease, oxygen dropping up to 80 and people don't feel it bad. It's called happy hypoxia. Hypo, low, oxia means low oxygen. So we become comfortable that when patient comes in the hospital, when their oxygen is 80, very little can be done. And that's why New York, there was very high death rate. Now we know that these people can be saved if we know early. So I think whenever you go in the emergency room or anybody, they give you the oxygen measurement, which you can do from your finger. And as soon as it drops below 93, person should go immediately in the emergency room and should be taken care of. So there are lots of new information coming, and these all information, we are showing that there is a very large number of people getting infected, but number of people dying is small. If you look at the New York data and look at today's data, you look at the graph. I'm not talking about New York. I agree that we are getting such a large spike in California, Florida, Arizona, Texas, that there will be such a large number. But again, fortunately, I hope that the new information, new treatment will save more people, and hoping that that might make a difference. And I hope we still don't forget the social distancing, wearing a mask, as well as hand washing, because this virus has a tendency to just stick and stay a little longer. Other thing, we learn about that receptor where this virus enters in the cell, called SC receptor, angiotensin converting enzyme. This particular enzyme supposed to help you converting from angiotensin 2 to 1, and 1 supposed to cause the vasodilations and decrease the storm, while 2 is a very difficult chemicals, and they cause severe vasoconstriction, and it's also one of the cause of the death. By knowing this, people have started using we know about the angioconverting enzyme inhibitor for a long time, because we are using for hypertension and for other medications. So there is more and more information coming, and I hope that those people who can get sick don't succumb to the disease. So that's where I will stop my corona information, and I think if the time permits, we can have some question answer. Now I'll talk about anemia. As a hematology, like a blood specialist, anemia is a major issue. Even in this country, 20 to 30% people are anemic. Anemia means low blood count. લો રક્તકણો છે એ આપણા હવામાંથી ઓક્સિજન લઈ and they are delivering to each and every cells. So if you don't have any oxygen, enough oxygen for the cells were compromised. If cell has enough oxygen and enough iron, one glucose, most of the energy what we have, it coming from the sugar. Even we have a fat and protein is important, but they need to convert in the sugar to give us the energy. So whenever you burn 1 unit of glucose, you produce 35 units of ATP. ATP has a special available phosphorus, so it can help every cells to do their function whatsoever they're doing it. I would like if I can, the ATP is like a horsepower. So one sugar produce 35 horsepower. Only first 2 ATP units can be produced without oxygen. But the last 33 ATP requires oxygen. So if you don't, let's say somebody's hemoglobin is 9, they're not producing enough, getting enough oxygen. So 50% of their respiration will be aerobic and 50% will be anaerobic. So I would say that they will produce about 15 units of aerobic ATP, 2 units of the anaerobics, total will be 17 units. But Bakinaji is 18 units, you lose it. So God might have given you like a, let's say, Ferrari, and you just behaving like a, for you it's like a Pinto. It's like a, so there is a quite a bit energy level difference. Whenever a person is like anemic, that their energy is drastically changed. If you are just sleeping all the time, doesn't matter. But when you're sitting, you're working, you're walking, and somebody like me, I climb hills and I run hills. I just had this morning my 2 miles in the morning. So whenever you need that kind of energy, you really need your hemoglobin. So beside those, I told you that the 18 units which you are supposed to produce, it's not, they are converted into lactate. And the lactic acid, you might have heard, it's a very painful. So if you have more lactic acid, you get muscle pain, bone pain, joint pain, headache, you can't sleep properly, means insomnia. Lots of people get like a depression, hair loss. I would say that I have gone about 100 villages in India, and I have spoken so many women. And if I know that most of the people's complaints is like related to anemia, they have more complaint, the very diverse complaint. I think most of us as a doctor, we understand if you have weakness, you have easy fatigability, you feel tired, you might dare, those are the anemic symptoms. But as a hematologist, as from my experience and from my extensive reading, I would say that the 90% of the problems in the village ladies are related to anemia. In this area, we decided what can we do? Ukabai Solanki, I think everybody familiar in this group. He was my best friend. We're coming from the same area. And we started a medical camp at Upaleta about 20 years ago. So when we started seeing the patient, most of the patients were anemic. And very few patients we couldn't do, lots of patients we couldn't do surgery because they didn't have enough hemoglobin. And we have really hard time getting blood transfusion in the smaller place in the beginning. So Ukaba and we thought that, hey, let's try to see what we can do for this anemia. So we sponsored the whole Upaleta Taluka, like 38,000 plus women and children we examined. And what we found that the average hemoglobin was 9.5, which we in this country, we see about 13 or 14. And perhaps like most of the women should have a hemoglobin 15 or 15.5 if they want to have the best energy. I'm 71 years old. My hemoglobin is 17. And I as I say, I climb, I run hill 5 miles a day. So I think this is the hemoglobin importance. My mother is 95 years old and she works 6-7 hours a day. We were coming from farm labors. My mother used to go in the labor job. And so she still has her datardi, and she does all the gardening and growing vegetables and fruits, not for us only, but all the neighbors, friends, for everybody. So what I'm saying that sometimes anytime, because our hemoglobin is 15. So whenever we get aging, we thought, hey, we don't have energy because it's a part of aging. I was just referring to a very nice article in New York Times that they checked the muscle biopsy of 90 years old and 18 years old. Those were very active. They both had a similar. So I think if we really able to understand the hemoglobin at any age, we can really go a long way. So how we try to work on this issue? So we sponsor a school, one boarding school where we had a little bit more control, and 1,000 girls, we checked their hemoglobin. They were getting a very good nourishment. Food was excellent in their hemoglobin was a little better than villages we checked. Their average hemoglobin was 9.9. So we went to those girls, we explained that your energy, your beauty, your talent, your academic as well as extracurricular, so many things you can improve if you can improve hemoglobin. Somehow in 90 minutes lecture, I was able to convince. I gave so many different examples where the hemoglobin can make a difference. I'll give you example like the cyclist. I'm just trying to who get the 7 medals. So recently, all the medals were taken. Why? Because he was using the drug which artificially was increasing his hemoglobin. His hemoglobin was more than 15, but he was still trying to do that. And then there is a special test for the medicine called erythropoietin. Then what he started doing, he was taking away his blood for 2 weeks before, keeping in the refrigerator, and on the day of competition, he was injecting. So my question is, if somebody has hemoglobin 15 or 16, he still wants to have the best. And that may be one of the reasons that he might be beating everybody. So all these girls was able to convince, and so first we checked everybody's hemoglobin. We explained them, this is most important to remember your hemoglobin. In this group, how many people know their own hemoglobin? Okay, so just first of all, and then we explain, because if you go anywhere, they will start telling you that you are not eating green vegetables. You are not doing this thing and that. That's not true. I think today's diet, there is enough enough iron in today's diet. No doubt. I'm a vegetarian like many of you. Vegetarian people don't have enough B12, because B12 only you can get from non-vegetarian items. Since we are drinking milk, and if you drink enough milk, perhaps you can get by. But still, in our experience, vitamin B12 deficiency is one of the major issues for vegetarian. So we try to explain them, and we manufactured the pills which has the folic acid, B12, and iron. And what we were able to explain them, your hemoglobin is low because you are not able to absorb the iron. Not your diet doesn't have enough. Your diet has more than you need it. However, you're not absorbing. So why people are not able to absorb the iron? Because in India, we have no matter how hard you try, the water has the germs, mainly parasites and bacteria. Whether you drink water right from Gangotri to even like Yosemite, when you go 13,000 square feet as height and you drink water, they have a giardiasis. So any water could have a parasite, and those parasites can stick in your intestine and stays forever. Sometimes you die with you. And they work symbiotic. They know what they want from you, and they let you, and they don't fight. They don't kill you. Otherwise they die. So people, whole India, whole rural India lives with parasitic infestation. And those parasites, particularly hookworms, they suck your blood. And that's why even if you're like hemoglobin, so if you're able to overcome, so first treatment we do in India is we educate them. If the people are not aware, they can do anything. We educate them, then we give them parasitic drug. Government giving free parasitic drug to everybody. Every students are supposed to have a parasitic drug every 3 months. So people knows they're ready. Then we give about a week rest, because what we have noticed that if we start iron on the first day, people already have quite a bit inflamed gut. And when we give that medicine, sometimes that the people cannot take it because of the side effect and stop taking it. So we gave about a week rest, and then we gave 1 tablets a day for 100 days. After 100 days, when we checked their hemoglobin, there was 13.25. From 9.9, it went to 13.25. And that was like even perhaps more than average hemoglobin in US general public, general female population I'm talking about. So there was a quite a bit satisfying response. And then we started that project and tried to see. So we talked to the doctors there and just say, hey, why we are failing? Why? What's happening? First, that we all understand that the water is the issue. So for that, we started going village. Most of the people who settle in this country, and we try to explain them that if you can provide the clean water in your village, 45% of the diseases can disappear in the village. And right now, I am running 85 RO plant in various villages. And so we are seeing tremendous response on that part also. So other thing that people cannot even like people, wealthy people are iron deficient. Why? Because first of all, that no matter how hard you try, it's very hard to escape the water without like a parasite. Like if I say, yeah, I come to your house and I see that, oh, there is a very nice machine there, I drink water, and all of a sudden wife complains, okay, our machine is broken for last 15 days, nobody's repairing. So it's a very hard to escape the water without parasite in India, particularly when you are living there forever. So second thing, that the iron needs to convert, like most of the food has lots of iron, but it is in the ferric form. It cannot be absorbed. The absorption on the cell surface, it requires only ferrous iron. Ferric means they have a 3 valency, ferrous has a 2 valency. So they need to convert. And to convert that, you need acid. So again, like most of the time, when you go with the medicine, the doctor will say, "Khatu khoru na khata, ane jaima pachi khajo." Actually, to take the iron is the best you take in the morning. So these are the issue. I know my time is 4:45. Tamaro ghano બધું બીજા function છે. I can come again sometimes, and I understand your timing, but I love to talk about the anemia, my experience, and what we can do and how we can do. Right now, we have taken, like, let me go over. So if you take iron with the milk, coffee, Coke, antacid, everything interferes. The best way to take iron is in the morning, early morning, empty stomach, and possibly with orange or lemon juice. That's where we are treating. I have treated 400,000 women. Last year, we have treated 70,000. And in one day, we have developed the capacity. In Umbrelli, we treated 6,100 girls in a single day. We educated them, checked their hemoglobin, explained that, given them anti-parasitic drug, and everybody was given the continuous of their care. So there is lots of opportunity, and I'll give you one extreme example. There was a village. I went there, and there is a lady who was listening so carefully, and she came to me, "Doctor, whatever the complaint, symptom you have described me, I have all this." So I thought, well, everybody tell the same thing. So it was nothing new. But after 3 months, I went the same town, I checked their hemoglobin, and her hemoglobin was 15.5. And then I started checking. Her original hemoglobin was 9.5. So this is like a labor lady who doesn't have anything, but she understood the importance. But baki to શું થાય કે wherever we go in India, we all have a PhD in listening because we listen so many things and very hard to execute. Somehow God has given us everything except the execution thing. So that may be like, you know, બધા ભગવાન બધાને બધું આપતી નથી દેતા. કદાચ આપણને થોડુંક એક્ઝિક્યુશન આપતા ભૂલી ગયા લાગે છે. બાકી બહુ શ્રદ્ધા આપી છે, બહુ પ્રેમ આપ્યો છે, બહુ ઘણું બધું આપણને as an Indian, we shouldn't complain to the God because we are one of the most fortunate people in my judgment. But that's why હું આજે મજૂર માણસનો દીકરો થઈને એટલે અહીં સુધી પહોંચી શકું છું. And so those are the things that, you know, we have so much. બસ વધારે હું કહીશ નહીં. ખાસ કરીને સુભાષભાઈ, we both born only 5 miles apart. And we are only 2 months apart in our birthday also. So just for the...
We have so many things common. And before we let you go, I have one more thing to request you. If you can spend few minutes on your expertise. You know, the fear of cancer is so much in the general public. And the prevention of cancer is always a topic of curiosity. I always want to know something new. Can you tell something?
My wife and we have started Cancer Prevention Foundation with Rajkot Cancer Society. We have already trained like 47,000 women in 1 year. And there is we have already very well established. I was going to talk to you, but again, my time has gone, so I don't want to take your time and your group's time. But someday I will come back and talk to you about the cancer prevention. I can tell you 2 or 3 things. If people understand about cancer and do all the necessary tests, 80% you can cure, you can prevent. 20% you cannot. You don't have a control. All of a sudden, I got a cancer of the pancreas 2 years ago. I just had a urine infection, and and it was second time. So we went for a CT scan. And on the CT scan, they found that I had a 6 centimeter mass on my tail of the pancreas. So that was just the incidental finding. So I was operated at Stanford, and fortunately my cancer was like a very low grade, which is like 1 in 400. So I was very fortunate that I survived, and my surgery was more than 2 years ago. And so far I have no any sign of recurrence. But as I say, cancer prevention, what we can do in India, why it's different. Here, like if you have a stage 1 cancer, 90% you will be cured. In India, if you have a stage 1 breast cancer, I'm talking about breast cancer now, 89% you will be cured. So like I'm saying that in India and here, we have a same cure rate for that stage. If you have a stage 4 cancer, perhaps here you might survive like 3 years. In India, people might survive 2.5 years because in that there are lots of drugs. In India, people cannot afford or might not have access. But as we say, whatever you can do here, you can do in India. Only thing, in India, 15% people are picked up in stage 1. Here, maybe 60. When I started as oncology 40 years ago, there was like might be 30%, sorry, 30%. Right now we are reaching 60%. So there is so much improvement, and I'm sure as we go, those numbers will improve. We'll be able to get a blood test instead of mammogram and able to tell you. So there is quite a bit. So if by doing this cancer prevention, we are hoping those 15%, if we can take 20, 25, 30, will save large number of lives in India. And similarly, like here, cervical cancer pretty much disappearing. In India is number 2. So HPV vaccine, pap smear. I'll tell you the story, sad story. Recently, I went to my 50th college reunion, my medical college reunion. And what I was talking to the people, and there was like 20 girls, my classmates. And I asked that how, there were 10 were doing like a gynecologist. And I asked them, how many people doing a pap smear for themselves? Forget their patient, 0. I asked them, how many people ever had a mammogram? 0. So somebody who's gynecologist, who's just practicing, and they're seeing the cases every day, still they are not able to just, so I think prevention, it doesn't exist in our DNA. So I think if we have this corona, and if they can enter their DNA and they can change our DNA and start understanding prevention, that can help us. કે એના બ્રધરને વર્મ ઇન્ફેસ્ટેશન્સ છે અને સિવિયર છે, અને હિમોગ્લોબિન એટલું બધું છે કે એને બ્લડ ટ્રાન્સફ્યુઝન વારંવાર લાસ્ટ 18 મંથથી આપવું પડે છે. તો મીનાબેનના જવાબમાં એક વસ્તુ કે આ જે વર્મ ઇન્ફેસ્ટેશન્સ છે એ ગેસ્ટ્રો ઇન્ટેસ્ટિનલ જે આંતરડાના ડોક્ટરનો પ્રશ્ન છે. એટલે એ કદાચ એમાં મારી એક્સપર્ટી એટલી બધી કામ ન કરી શકે કે એને કઈ જાતનું છે, એને માટે એને શું ઇન્વેસ્ટિગેશન કર્યું છે, અને વાય દે આર ફેઇલિંગ. બરાબર, તો હું તમને આમાં બહુ જવાબ નહીં આપી શકું. મારી સાથે ક્યારેક હું ગેસ્ટ્રોએન્ટ્રોલોજીસ્ટ કે આખી પેનલ લઈને આવીશ અને તમને બધાને આનો જવાબ આપવાનો પ્રયત્ન કરીશ. પણ એનું એનિમિયા છે, એને જરા ઇન્વેસ્ટિગેટ થયેલું હશે, રિપોર્ટ તમે મને બધા મોકલી આપો, અને કદાચ એમાં ન આવ્યું હોય, ન સમજી શક્યા હું સમજી શકું, તો હું તમને આઈ વિલ ડેફિનેટલી ગીવ યુ ઓલ ધી હેલ્પ આઈ કેન ગીવ. નેક્સ્ટ ક્વેશ્ચન.
Dr. Saib, હિમોગ્લોબિન ઓવર ધ કાઉન્ટર તમે જે કોઈ મેડિકેશન છે કે જે આપણે અહીં લઈ શકીએ to raise the hemoglobin? Number 2, how to lower the lactic acid? Lactic acid is a part of, if you exercise, it build up the, so when you mention two things, how can you give us some guidance?
ક્વેશ્ચન છે જગદીશભાઈ પુરોહિત તરફથી કે હિમોગ્લોબિન ની ટેબ્લેટ્સ છે એ ઓવર ધ કાઉન્ટર કઈ સારી આવે છે, અને ખાસ એનો જાણવું છે કે લેક્ટિક એસિડ માટે શું થાય. ખાસ કરીને આજે મારે રૂટ કેનાલ કરેલી છે, એટલે મારો આખો ફેસ છે ને, આઈ એમ જસ્ટ ટ્રાઇંગ ટુ પ્રોટેક્ટ માય લિપ. તો બેઝિકલી લેક્ટિક એસિડ ઇટ્સ અ વેરી પેઇનફુલ. તમે કદાચ તમને કોઈ મસાજ થેરાપિસ્ટ આવે ને, આપીને તમને છેલ્લે પાણીની બોટલ આપે કે ભાઈ તમારું જે લેક્ટિક એસિડ છે એ તમે પાણી કાઢી અને તમારા શરીરમાં થોડું ઓછું કરી શકો. એક્સરસાઇઝ કરવાથી જે આપણને કંઈ પેઇન થાય છે, જે તમે મેરાથોન જોતા હશો કે પીપલ ગો ઇન સિવિયર સ્પાઝમ, અને થોડી વાર એને પાણીની, એટલે એને માટે એક જ ટ્રીટમેન્ટ છે કે પાણી તમે પીધે રાખો ખૂબ. અને બેસ્ટ થિંગ ઇઝ બ્રિંગિંગ ધ હિમોગ્લોબિન અપ. એઝ આઈ સે કે જે તમારા એક ગ્લુકોઝ બર્નમાંથી 35 યુનિટ એટીપી કરી શકો, ના કરી શકો ત્યાં સુધી તમારે થોડે ઘણે અંશે લેક્ટિક એસિડ રહેવાનું જ છે. તો બેસ્ટ થિંગ ઇઝ, એટલે અને ખાસ હિમોગ્લોબિન અને આયર્ન બે, ધેર આર પીપલ હુ હેડ હિમોગ્લોબિન સારું પણ આયર્ન લો હોય, એને નોન એનિમિક આયર્ન ડેફિશિયન્સી કહે છે. એટલે તમારું હિમોગ્લોબિન સારું હોય, જો તમે છતાંય તમે આયર્ન તમારું ચેક કરાવી શકો. આયર્ન ઇઝ સચ અ ઇમ્પોર્ટન્ટ થિંગ ઇન ધ લાઈફ, ઇટ કેન ચેન્જ યુ એઝ અ પર્સન.
Right.
ને હું જસ્ટ આ વાત કરું કે મેં પેલા બેનની વાત કરી હતી ને કે જેનું હિમોગ્લોબિન 9.5 હતું એનું 15.5 થયું 3 મહિનામાં. ઈ બેનને માટે મેં કેટલા પૈસા ખર્ચા કે એનું હિમોગ્લોબિન ચેક કરવાના 20 રૂપિયા, 2 વખત એટલે 40 રૂપિયા, 2 રૂપિયાની આલ્બેન્ડાઝોલ આવી 42, અને 30 રૂપિયાની 33 રૂપિયાની 100 ગોળી આવે છે. 33 રૂપિયાની અમે જે મેન્યુફેક્ચર બનાવી છે 33 રૂપિયા અમને આ બધી કમ્બાઈન કરી અને 100 ટેબ્લેટ આપે છે. તો એ ટોટલ કોસ્ટ હતી 75 રૂપિયા, એટલે ઇટ કોસ્ટ મી લાઈક $1. આજે મારે એ જ હિમોગ્લોબિન આ કન્ટ્રીમાં 9 માંથી 15 કરવું હોય, ઇટ કોસ્ટ મી $4,000. નોટ મી બટ ધ પેશન્ટ. કે અહીંયા છે તમારે એનો આયર્ન ચેક કરવું જોઈએ, તમારે માપેલું હોવું જોઈએ, તમને આયર્ન મળે પછી એનું કોઝ શોધવું જોઈએ. જો ના થાય તો યુ કુડ બી લાયેબલ. એટલે એને એન્ડોસ્કોપી કરાવવી પડે, કોલોનોસ્કોપી કરાવવી પડે. આ બધું કર્યા પછી જ તમે એને નક્કી કરી શકો. there are so many issues. I'm just trying to say that બટ અગેન ધીસ ઇઝ જસ્ટ કે એક તમારો $1 છે એ માણસની લાઈફ કેટલી ચેન્જ કરી શકે છે. તો એની પ્રોજેક્ટ આઈ ઓલવેઝ થિંક કે ઓછામાં ઓછા પૈસે આપણે શું કરી શકીએ. આપણી પાસે જે એજ્યુકેશન છે, આપણી પાસે એક્સપોઝર છે, આપણી પાસે એક્સપિરિયન્સ છે, વી કેન રિયલી મલ્ટીપ્લાય બેક હોમ. વી ડોન્ટ નીડ એવરીબડીઝ મની. આપણે બીયુ પટેલના મની વિલ બી ઇનફ.
So now,
just kidding.
and one more question: folic acid, B12 and iron. Any koi over the counter medicine અહીં મળી શકે છે કે do you
ના મળી શકે તો ક્વેશ્ચન છે કે ભાઈ B12 આયર્ન ને ફોલિક એસિડ ની મળી શકે. ના મળી શકે તો તમે પ્રીનેટલ વાઇટામિન્સ ને એની સાથે એક એક્સ્ટ્રા આયર્ન લઈ શકો. બહુ સસ્તી હોય છે. એટલે જુદી જુદી તમે B12 તમારે ભેગું લેવાની જરૂર નથી. ત્રણેય જુદી લઈ શકો. આ તો ખાલી અમે તો કન્વીનિયન્સની માટે અને પુઅર પીપલ ને હેલ્પ કરવા માટે ઓછામાં ઓછા ખર્ચે કઈ રીતે થાય એ રીતે આખું વિચારેલું.
ઓકે ડોક્ટર, હજુ એક ક્વેશ્ચન છે. નેક્સ્ટ ક્વેશ્ચન મીનાબેન પટેલ, ગો હેડ. વોટ્સ યોર ક્વેશ્ચન મીનાબેન? તમારે અનમ્યુટ કરવું પડશે તમારી જાતને. હા, નાઉ વી કેન હિયર.
મેં યુટ્યુબમાં રિચર્ડ બાર્ટલેટ એને ગઈકાલે સાંજના સાંભળ્યો. ટેક્સાસમાં છે. And he is teaching people.
ઓકે, ગો હેડ. વાંધો નહીં.
મને સંભળાયું નથી કઈ. બેને કોઈ રિચાર્ડ ને સાંભળેલો છે
તમારો ક્વેશ્ચન ફરીથી કહો.
ગઈકાલે સાંજના મેં યુટ્યુબમાં રિચર્ડ બાર્ટલેટ એ ડોક્ટરને સાંભળ્યો. He was treating his patients with corona in Texas. And he says it's very simple to treat them and get them better. It's to give them antibiotic like erythromycin, zinc, and inhaled steroid, which is Pulmicort, through nebulizer. And he has treated lots and lots of patients with that. And in Japan, Taiwan only had 7 people who died. In Japan, they are using this and they are curing so many people. Do you know anything about that?
Okay, very good. મીનાબેન નો ક્વેશ્ચન છે કે ડોક્ટર રિચર્ડ બાર્ટલેટ છે એ સ્ટીરોઇડ, એન્ટીબાયોટિક્સ અને 3 વસ્તુથી ટ્રીટ કરે છે અને હી સેવિંગ સો મેની લાઈવ્સ. અને જાપાનમાં અને તાઇવાનમાં અને સાઉથ કોરિયામાં બહુ જ ઓછા ડેથ રેટ છે. તો આઈ થિંક મને એમ છે કે there is quite a bit medicine available. Unfortunately, જે સાઇટોકાઇન સ્ટ્રોમ થાય છે, આપણે સ્પેસિફિકલી જે nursing home bound patient હોય કે who are really sick, who already has they able to get out of the cytokine storm is getting a little bit harder. However, we have known it this is like a cytokine storm. As an oncologist, I am familiar. We have quite a bit experience, and steroid was the right treatment. તમે કીધું કે steroid inhale કરી અને એ આપણે એને આપી શકીએ. તો એ ટ્રીટમેન્ટ છે. પછી અત્યારે વાયરલનું રિપ્લિકેશન ના થાય એના માટે રેમડેસિવિર છે, એવી બીજી એન્ટીવાયરલ ડ્રગ્સ છે. એ ઉપરાંત તમે પેશન્ટને એક વખત બ્રીધિંગ પ્રોબ્લેમ થાય એને પેલા શું કહે સુપાઇન પોઝિશનમાં અને બદલે પ્રોન પોઝિશનમાં રાખો. તો એક સ્ટડી હતી કે પ્રોન પોઝિશનમાં પેશન્ટ છે 41 ડાઇટ થયા, બીજામાં 20 જ થયા, એક એક્ઝેક્ટ નંબરમાં. So there is quite a bit. So there is so much information available. So I think once the patient has the disease, I think that, and most of the doctors, they are up to date. They have all these things at their disposable. So I think what we have, when we had all those deaths in New York, that time we did not have that information. But now we have quite a bit information. Okay, next question. Right. I'm sorry, I couldn't answer. I'm just saying that there is lots of treatment available. I tell you in the beginning, we can dissect we dissect the cell We dissect the IL-6 inhibitor. I just didn't try to confuse with so many drugs. But as I'm just short, we have excellent plans today. I think I have a group from somebody who's helping me from anemia. He has joined from India. Hello, Santilal. I'm so glad you are here. Go ahead, continue, please. Next question.
Subhash bhai, I have one more question from Govind Lalani. So I'm going to unmute him.
All right.
Govindji, unmute yourself. Unmute yourself.
Govind Lalani જેવું નામ જ સાંભળ્યું નથી કોઈ દિવસ.
Yeah, Govind Lalani. Okay, on now. Go ahead.
Hi.
Pistachio and things, and go pick it up and do that. You need anything from there?
One is coming tomorrow.
એમાં બીજા અહીંયાથી જે કોઈને જોઈન થવું હોય કે પોતાના $1 માટે
સુભાષભાઈ
હા યસ એક મિનિટ બીજો ક્વેશ્ચન ચાલે છે આપણે થોડી વાર સાંભળીએ.
Yeah.
Doctor, you have to repeat the question.
ઓકે, ગોવિંદભાઈનો ક્વેશ્ચન છે કે આપણે $1 આવી રીતે માણસની લાઈફ ચેન્જ કરી શકતા હોઈએ તો કોઈ how other people can join and what can. By the way, Govindbhai and we are best friends since India, like maybe almost 40 years. So and here we do all the project together, like the Upleta medical camp. Govindbhai, me and Ukaba had started. I forgot to give him a credit because I was talking about Ukaba. So basically, now the question is, how can you do? You can sponsor a school, and only thing like you might have a 300, like તમે G high school માં ભણ્યા છો કે G school માં ભણ્યા છો, you can go there. Hey, I have like a 200 student. Just it will cost you 200, and I'll make sure that each and everybody will get their blood count and free medicine wherever you are, as long as in the like a vicinity, because we just have a sometime driving distance, and if we with a small group we had a hard time, because right now our goal is to do 100,000 this year. So we not picking up a smaller, because it taking lots of but again, I think if you want to do in your area, we can always think about it, and we can pass on that. We have created lots of clone. We have created some girls who are trained, who can give a lecture, who can check the blood, give the medicine, and then one person can give and finish the 500 people one school. But we can. Same thing in the village, same thing your community. Like suppose if you are Soni Mahajan community or Patel community or Brahmin community, I have gone through like a large 4 Muslim organization in Rajkot, and we have treated everybody and able to really treat. And I think I was so fascinated knowledge and the way they really wants to pursue in this direction. So I think it can be feasible anywhere, any place. Next question.
એક મિનિટ, આપણે મનુભાઈને સાંભળીએ. નમસ્તે મનુભાઈ, વેલકમ ટુ અવર ઓટલો. અમે આને ઓટલો કહીએ છીએ. તમે આજે આવ્યા એ અમારા અહોભાગ્ય. વેલકમ.
Okay, Dr. Bhanjibhai, everybody can listen to me? Is my voice okay?
Yes.
Okay, so I just looked at the Dr. Richard Bartlett, who is from Midland, Texas. Whatever he claimed, the Memorial Hospital, Midland Memorial Hospital says it's not true. Okay, so you verify the facts. He is the doctor right in the Midland, Texas, but Midland, Texas, biggest hospital the hospital name is Midland Memorial Hospital, says inhaled steroid is no silver bullet for COVID-19. All claims are not verified.
Yes. So again, like there are so many research going on. Most of the we are listening is a like a because any research go like a 3 stages. So what we have data is only stage 1 and stage 2. Until it becomes stage 3, that particular medicine doesn't become standard. Just for your information for everybody.
અને એના કન્ટિન્યુએશનમાં મનુભાઈ જો હું કહું તો જો ઇન્ટરનેટનું બધુંય સાચું માનું તો આજે સુભાષચંદ્ર બોઝ અને એલ્વિસ પ્રેસ્લી બંને જીવતા છે. તો કેટલું સાચું માનવું એ આપણે નક્કી કરવાનું.
Since Manubhai is here, Manubhai is here. Manubhai is involved in so many children's welfare and education, and he is also now just jumping on the anemia and really has so much more. I want to listen from you, Manubhai, instead of just I tell you that.
No, I understand. I was shocked to see the statement. YouTube has about 15 statements on Dr. Richard Bartlett, but then on Google I checked, and the last claim where he says this is a silver bullet, immediately within 1 hour says Midland Memorial Hospital. There is no scientific proof, no carefully evaluated peer review studies, and that proves the efficacy of those statements. So it's kind of there are a lot of things. Google is a great place to double check all this claim and counterclaim and what is right and what is not right or what we require. That's all. I normally don't want to talk on this subject. So, on the anemia, I'm working with Dr. Bhanjibhai Kundaria, Purdue University, Emory University, and we are coming out with a app where poor people, either their nail or their eyelid, by taking a photographs and scanning that photographs through the scanner of the cell phone, your smartphone, it will be able to say what is your anemic hemoglobin level. And we are running the test this week and next week here for 300 people. Dr. Nitin Shah will run 200 and Dr. Bhanjibhai Kundaria or his staff will run 100 and see how accurately the claim of Emory University and Purdue University, where we are donor at both locations. And if that is a truth, that will change how you can evaluate a condition of anemic condition in children's, in women's, in girls of that age from 12 onwards. They lose a lot of bloods, and during that time, what happens? And Bhanjibhai taught me something very important that I want to tell. He says that all this educational money we spend in schools, including Pratham, Ekal Vidyalay, Akshay Patra, keep in mind if they have anemic condition, in other words, a girl's having in 13 years, 12 years old or 14 years old, and it's an anemic condition, that is, they're working at 80 horsepower out of 100 horsepower. In other words, they're not paying attention to what is being taught. They cannot fairly compete with everybody else. So bring that anemic condition out of them. And that has been proven by many places by Dr. Bhanjibhai Kundaria. And that has excited me because in my childhood, between age 12 and 14, I was anemic. And after, I didn't realize I'm anemic, but for whatever reason, my diet changed and my anemic condition and my education standard improved tremendously. And I was talking this subject to the Purdue University professor. He himself claimed, this is in America, his own son had a similar symptoms and he did not realize. He was saying, hey, like all Indian parents, why you are not getting A, okay? He did not realize that he had a anemic condition which will not allow him to use his brain at the best. And now that has been corrected by the Professor Arvind Raman. Okay, so these are personal experience. Anyway, Bhanjibhai, keep doing great work. Thank you, and you continue your work.
Thank you. I think at this point also, I like to see like BU Patel has sponsored 500 villages. And we are trying to see that in his program, how this anemia part can be incorporated. He's trying hard, and we have gone there at Tarsadia University and able to start up the project. So I'm sure we have quite a piece response in various arenas where we can go in the villages, going in the school, going in the university. Saurashtra University has given us like 100,000 students to improve their hemoglobin. So there is so many challenges we are expecting. But I think on the individual level, you think about your village, think about your school, think your high school, your college. You can make a tremendous difference in your $500.
The one more thing I like to add, Doctor, is in Dharampur, Srimad Rajchandra Hospital, they saw a lot of Adivasi people in that area. And there was one very peculiar problem with the woman, and they have both infant mortality and they have also early childbirth at 6 months, 7 months, 7.5 months. Now, 6 to 7 is very difficult, but 7 months they try to save the child. They spend a lot of money. A good chunk of the cause is anemic condition during the pregnancy. And that is why they are so excited about this program. And they are also working with Purdue University to see how this can go to the root cause. If it's anemic condition, the child will not born, will go to the full term, and if it goes to the full term, the cost of saving that child is so huge that if they can provide iron tablets and other remedy for what, and this situation is even worse for vegetarian who don't eat chicken or fish. So all these things is told. Dr. Bhanjibhai has done amazing work, and I'm following up in many areas with him, and it will do some wonder on next 2-3 years. Thank you, Bhanjibhai.
Looking forward, I think we can really make a huge difference. Let's say other question about individual, how about anemia, what we can do. Just please, from the audience.
Doctor, I have somebody from my side that has a question. Vasuben, તમારે unmute કરવું પડે તો તમારો question અમે સાંભળી શકશું. Vasuben, તમને સંભળાતું હોય તો unmute કરો. Doctor, while she is coming on the screen, I have a question. We are talking about anemia, and there was a follow-up question કે ભાઈ અમને આયર્નની ગોળી ક્યાંથી મળે? આપણા જગદીશભાઈ કદાચ પૂછ્યું હતું. So I have a question of my own. Isn't it that after 50, taking iron is detrimental? Rather, it's not helping.
That's okay. I think the question I would say, okay, iron is a detrimental, and that's a true, very important question. I think those people who have excess checking their iron level, they should check their iron level. And iron level means there are two tests: serum ferritin, means blood ferritin, and iron saturation. If you have those two tests normal, you should not take iron. Because once iron comes in your system, it's very hard to get rid of it. And if iron keep on accumulating, it can cause the liver cancer and cardiac failure. It happens somebody who has a lifelong iron absorption. It doesn't happen to other people. But I'm just telling you with this kind of smart audience. India, we have different problem, because we have a poor people, villagers, students, and we try to ask them to measure their iron whenever it's possible. One student I am affiliated, where I teach them every day 90 minutes from here. And in that school, like everybody has a hemoglobin 13 or 15. And we check their iron storage level, and none of them has, in spite of giving for last 3 years, none of their iron has gone up to be danger level, just to, or even more than it should be. So usually somebody who's iron deficient shouldn't have problem. Elderly people should check their iron level after 50. And ferritin. And I think the women's will find that 30% women will have iron deficiency, even though their hemoglobin might be low. So I think they can benefit. Iron is not only good for your red blood cell or hemoglobin, it's good for your muscle, myoglobin. So sometimes, you don't feel short of breath, but you have lots of muscle pain or feels tremendous fatigue. So that's a myoglobin. And nowadays they are talking about neuroglobin, that in the brain, like how we can think, how fast we can think, how our reflex, they also depends on that. So iron deficiency is too bad, but normal iron, don't need to worry. And iron overload, there is a treatment, it's hard. So I think please check those whose insurance covers, check your iron. While we are talking about, I have Santibhai from India. He has joined us, and he is the one who had treated this many large number. And he has so many stories to tell. Santibhai, I can give you a minute if you can talk to you about your patient.
Santibhai,
Santibhai Faddu from India.
અરવિંદભાઈ તમારામાં છે શાંતિભાઈ, એમને અનમ્યુટ કરો.
Let's don't worry. We go ahead. Next question. If he comes, we'll take him. Let me ask Bhikkhubhai, B Patel, can you make a comment while we are listening? Just I know you've been so much involved and always encouraging us.
For the good purpose of people, Bhanjibhai has started this project, and we are becoming part of him. He is my close friend. He has come to the Bardoli, our center, where we have a university and our charitable trust, and he stayed with me. And my experience as a human being, so wonderful he's doing. Let's support him, because and we have already started the program, and I'm proposing right now, anybody want to donate it up to $50,000, I will match it. So let's start things. Or 10,000, 20,000, whatever money speaks, and whatever the heart you have right now, tell us. This is the way we want to work.
We need it both to be able to get by.
This thing, can you hear me?
Yes, we are listening to you.
So just listen, humanity starts with the donation, and when you give any kind of a donation to anybody, you feel good. Forget about anybody else. So always think the term that which is the better for you, to sacrifice or enjoy the life.
Yeah.
That doesn't matter. We have to enjoy, not enjoy the life, but there is always some excess. Everybody has it. $1, $2, $5, $10, $20.
Thank you, Tom. Really appreciate it.
So please help him develop it. But I will double the money. Whatever people want to send him, I will double that money.
Wow, what a nice. I think those people didn't hear on the other side. If anybody wants to send money for anemia to your village, B.U. Patel will double it up just for anybody who is. I think let's give this project to Jagdish Bhai and Subhash Bhai. Both can figure out if there is any inquiry comes. We are not here for any kind of donation or anything. Just like if you want to do any project in your village, we help you. Basically, our goal is just to carry out, help you to execute your project. Okay, now I think I have to leave. I'm so sorry. I have to leave.
Thank you, Manubhai. Let's go. Your wife is more important.
My wife ne surgery puri thai cha. I have to go now.
Absolutely. Go ahead. Thank you.
Thank you for coming here. અને આટલું ટેન્શન માં બી તમે અમારી સાથે બહુ શાંતિથી વાતો કરી તમારો આભાર. અને
એને સમઅપ કરતા આપણે કહીશું કે ઉલ્લેખ એનો જ થાય છે વિજ્ઞાનમાં અને ઉલ્લેખ એનો જ થાય છે ઇતિહાસમાં કે જે પ્રશ્નોને લઈ જાય છે ઉત્તર સુધી. અધિકાર એ છે માત્ર વહેતા ઝરણાનો અને તે જ પહોંચી શકે છે છેક સમંદર સુધી. તો આજે તમે આવ્યા આ બધા મહાનુભાવો, આઈ એમ રિયલી સરપ્રાઇઝ એન્ડ શોક એન્ડ સ્તબ્ધ થઈ ગયું છું. But very happy.
Thank you very much for inviting me. This was a really great pleasure. I'm so glad that we are able to just join and chat with this man, large audience. Looking forward to be back sometimes.
Right.
And we just
we want to thank you so much for coming and your valuable time. We would like to bring you back at another time because there are a lot of questions. You have also sent me an email with all the information you have talked about, which I will forward to Subhasbhai, and they will have the information.
Okay. I forgot to tell you about the role of exercise in Corona. I think I have sent that information to Jagdishbhai. Please, you can, if you have read it, please talk to the couple of minutes. Okay, good night. Thank you.